Hello again, and welcome to today's webinar on high-impact HIV prevention. We're going to go ahead and get started, although I know that some people are actually still joining us. We've been told that GoToWebinar has been having a little bit of technical difficulty with the call-in number that was assigned to us. So if anybody's having trouble getting on to the audio portion, if you click on the problem dialing in link, it'll give you an alternate phone number that you can use. And you're also welcome to listen to the audio presentation today using the computer speakers or the speakers on your laptop. So today's webinar is hosted by Capacity for Health. We are actually funded by the Center for Disease Control and Prevention to provide free training and technical assistance to community-based organizations that do HIV prevention programming. We are the Capacity Building Assistance branch of the Asian Pacific Islander American Health Forum. We are based largely in San Francisco, although we also have a Washington, D.C. office. My name is Sonia Dublin. I'm a Capacity Building Assistance provider here at Capacity for Health at the Health Forum. And I will be facilitating today's webinar along with our wonderful presenter, Shelley Facente, who I will introduce in just a minute. Because we're funded directly by the CDC, we actually get to provide a lot of really amazing free services to support organizations who do HIV prevention. And we work with them in a whole variety of areas. We do things like this webinar series. We also do a lot of trainings. We organize conferences and meetings. But we also can work with organizations one-on-one to support their program development, implementation, and evaluation. And we're not limited to just supporting specific programs or initiatives. We actually do a lot of work based around kind of the organizational wellness. So we can help with strategic planning or board development or fund development or fiscal management issues. Then we also do trainings around some of the very specific interventions and public health strategies like HIV testing. We're going to be talking about a lot of those interventions today as we talk about the different interventions that are being prioritized under high-impact HIV prevention. And then finally, we do a lot of work around monitoring and evaluation and helping folks to really understand what's working and what's not working in their programs and organizations. So we'll talk a little bit more at the end of today's presentation about how to access these individual kind of one-on-one support services, as well as a number of other resources as you start thinking about how to best implement high-impact HIV prevention. Just a few logistics before we get into our content. Everybody has been automatically muted. We probably aren't going to do a lot of live discussion because this is such a large webinar, but there is an opportunity for you to ask questions at any point in time using the chat feature, the questions feature, which is in the bottom right-hand side of your webinar control panel. Also, if you would be so kind, if there are multiple people around one computer, just go ahead and use that questions feature to chat in your contact information so we can include you on any follow-up from today's webinar. We will be sending out and posting on our website the slides that we're going to be sharing with you today, as well as an informational sheet that has sort of a summary of everything we'll be talking about. And finally, today's webinar is going to be recorded. The recording will be available on our website along with an online training version of today's content. So we'll talk a little bit more about where to find those things at the end of the presentation. So as I mentioned, we have another presenter joining us today, Shelley Facente. She and I have both been working in the field of HIV for almost 2 decades. It tells you a little bit about how old we are. Shelley has done a lot of work on a local level with the San Francisco Public Health Department, as well as national and international HIV prevention work. She has done everything from direct service work to program development and management and evaluation. And I've been lucky enough actually to work with her on a number of different projects over the past 5 or 6 years, I think, since we first met. So Shelley and I will be tag teaming a little bit today. And Shelley, do you want to say anything else in terms of introducing yourself?
No, I think you covered it. Thanks.
All right. Well, I'm going to turn it back over to Shelley in just a minute. But first I want to just set the stage for a little bit kind of the overview of what we're going to be talking about today. So this concept of high-impact HIV prevention is a little bit of a hot topic right now. Actually very much of a hot topic right now. As I think folks are aware, it's the CDC's new terminology and new approach to HIV prevention that's really their response to the National HIV/AIDS strategy and to the priorities of the National HIV/AIDS strategy that was released in July of last year. So really what we're focusing on in this webinar, and this is the first in a series of 3 webinars, this webinar is really the overview of kind of what this whole approach of high-impact HIV prevention is. What does it mean when people talk about high-impact HIV prevention? And specifically, we want to talk about the different the different kind of components within that, and a little bit, a very brief overview of some of the specific interventions, although mostly that's going to come in the next 2 webinars. So today is really going to be that overview piece about what high-impact HIV prevention means, how do we even approach this new framing, and how do we apply that new frame to the work that we're doing in HIV prevention in our programs and in our organizations. As part of that, we're also going to be talking quite a bit about prevention with positives, because that has a big emphasis within the new HIV, the high-impact HIV prevention field. So here's our specific learning objectives. Again, it's really focusing on sort of the overview and then talking particularly about prevention with positives. And like I said, we will touch on some of the specific interventions, but more of that's going to come in the 2nd and 3rd webinar of this series. So 2 weeks from today, we'll be doing a webinar on linkage to care and specifically looking at treatment adherence and some of the new medication adherence interventions. And then on July 11th, so 5 weeks from today, we'll be doing the 3rd part of the series, which will focus on high-impact HIV testing. And again, we'll get into more of the nuts and bolts of the specific interventions that fall within those kinds of categories when we get into the next 2 webinars of this series. So again, at the end of the presentation today, we'll talk about when the next 2 webinars are, how to get registered for them if you haven't already, and make sure that you leave the end of today's webinar with lots of resources for your next steps. So we're going to start by talking about the overall approach, kind of where it comes from, what it's based on. Then we are going to talk a bit about this kind of concept of proven high-impact interventions and the kinds of interventions that are being emphasized in the new high-impact HIV prevention approach. Then we'll talk a bit about prevention with positives, where it falls within this emphasis on high-impact interventions, high-impact approach. And then we'll leave the end of the webinar with lots of resources and materials, including how to tap into the rest of the series, parts 2 and 3 of the series, as well as how to get more individualized in capacity building support from us if you're interested in that, and as well as some other online resources that are available. So before we get too much into the content, we're going to go ahead and do a little bit of a quick poll. We really would like to hear from all of you on the line what it is that you think of when you hear high impact. High impact HIV prevention, what is it? What do you think makes an intervention high impact? So you're going to see a quick poll open on your screen right now. Go ahead and poll in. And in the meantime, I'm going to turn the audio over to Shelley so she can talk a little bit more about this background of high impact HIV prevention.
Great, thanks, Sonia. So while you're all responding to the poll, I am going to say a bit more about why we need a new approach to HIV prevention. So really, we've spent the last 30 years learning about HIV and learning how best to prevent HIV. And we've done really good work in doing that. And so with all this experience, now we have an opportunity to adjust our approach, to emphasize best practices, and increase our effectiveness, to basically take a moment to take pause, take stock of what we've done, and figure out the best path moving forward. We also know full well that this is an era of limited resources. So given the funding cuts that everybody is facing all over the country, I'm sure you're all feeling it, high-impact HIV prevention helps us prioritize prevention interventions to make sure that the limited dollars that we do have are being used to the best possible extent and that we're really minimizing waste in that way. And also, we all want to have a high impact on the HIV epidemic. That goes without saying, nationally and in our local communities. So using the lens of high impact HIV prevention just helps us to feel confident that we are doing that. So that's really the reasons behind it. Let's see what you all said about what makes an intervention high impact. So many of you said it significantly reduces HIV incidence. It also reaches many people for little money, and the vast majority of you said both. And so that really does make sense, and that gets to a lot of what I was saying. So thanks for responding to the poll. That's very helpful. Now we're going to jump into directly talking more about the details of HIV prevention. So all right. So let's start with explaining the background of high-impact HIV prevention. This is the term that the Centers for Disease Control and Prevention, or CDC, uses to describe their new approach to reducing HIV infections in the United States. And the idea is that it's designed to maximize the impact of prevention efforts for all Americans at risk for HIV infection. So that includes gay and bisexual men, communities of color, women, injection drug users, transgender women and men, and youth. All of those fall into this category.
Shelley, we're not actually seeing your screen yet. If you can go ahead and click the play button. great. Thank you so much.
You're seeing it now. Okay. Oops. Okay, sorry about that. All right. I'll keep going. So, as I was saying, so high-impact HIV prevention, it's actually building on the priorities of the National HIV and AIDS Strategy, which you've probably heard. Sometimes it's referred to as the NHAS. And that was released by the White House Office of National AIDS Policy in July of 2010. It's the first time that we've had a National HIV/AIDS strategy, so it's a really big deal, and this builds on that. And there is definitely delay. There we go. So the National HIV/AIDS strategy lays out a lot of important priorities for HIV and AIDS in the United States. And when it comes to HIV prevention, there are really three main priorities. The first is to intensify HIV prevention in the communities where HIV is most heavily concentrated, so really focus in the efforts. And the second one is to expand targeted use of effective combinations of evidence-based prevention approaches, really targeting them, using them together effectively, making sure they're based in evidence we know that they're going to work and have a high impact. And then the third one is more broad, to educate all Americans about the threat of HIV and how to prevent it. So given those priorities that the NHAS lays out, CDC responded by reframing their own priorities for HIV prevention, and this reframing is what we know as high-impact HIV prevention. So now we'll talk about what makes an intervention high impact. So there's 5 overarching considerations for what would make something considered high impact. The first is effectiveness and cost. So basically under high impact HIV prevention, the highest priority is placed on those interventions that are most cost effective at reducing overall HIV infections. So interventions that have rigorous cost effectiveness data and are able to show a high positive impact per dollar spent are the ones that are most supported under this approach. So some examples of interventions that are proven cost-effective that really do a good job in this first consideration are HIV testing and condom distribution, because both are relatively low cost in the scheme of HIV prevention interventions, and they've been shown to be very effective at preventing new infections. So they're cost-effective. And prevention with positives, because really it's easier and more cost-effective to focus on the much smaller group of HIV-positive people to prevent transmission than the much larger group of HIV-negative people. So it's a cost-effective move. The second one is the feasibility of full-scale implementation. So in this case, highest priority is placed on interventions that are practical to implement on a large scale at a reasonable cost. So an example of this would be condom distribution or distribution of sterile syringes. Because they happen in these really large bulk efforts, they quickly reach a great number of people at risk for HIV infection. Very big in full-scale implementation. So under high-impact HIV prevention, more time and resource-intensive interventions like individual or group counseling interventions, those are really reserved for people at the very highest risk of HIV transmission. And they're not the best choice as a more general intervention that's meant to reach larger groups of people. The third consideration is the coverage in the target populations. And in this case, priority is given to interventions that have the ability to reach a large number of people. So it's not so much about the full-scale implementation in this case, but it's just that you can reach large numbers of people. An example of an intervention that's very strong in this area is routine opt-out HIV testing in healthcare settings. Now this intervention is challenging for many healthcare settings to implement, which is why we didn't include it as a best example of the feasibility of full-scale implementation criterion in the last slide. But there's no doubt that when it is successfully implemented in a healthcare setting, this intervention reaches a large number of people, and it has the potential to identify a number of undiagnosed HIV infections and make further transmission less likely. So it's a really good fit for this third consideration. The fourth one is interaction and targeting. And what this means is that priority is given to interventions that can be most effectively combined to enhance prevention efforts for the most affected populations in an area. So a good example of this is HIV testing plus treatment adherence as a combination. So interventions that help people living with HIV adhere to their treatment regimens can be effective on their own in preventing further HIV transmission, but these treatment adherence interventions are only effective if people know they have HIV and they're linked to medical care so that they can obtain treatment. And so combining treatment adherence interventions with HIV testing interventions that boost the number of people living with HIV in an area who know their status and are linked to care will actually exponentially increase the positive impact of both interventions. So any kinds of combinations like that are considered to be high impact. And then the final consideration is prioritization. So what this means is that under high impact HIV prevention, priority is given to interventions that are best suited for a particular population or a particular geographic area. So they're not just kind of one size fits all, but people really have figured out that for the people in a population or an area that they are targeting in their specific program, this intervention is best suited for them, and priority is given to those. So there's no examples of best interventions for this consideration, because that's the whole point. Different interventions work better for different populations in different areas. So there's no real example. The important thing is to rigorously assess the potential impact of HIV infections from these interventions, and then make evidence-based decisions about which ones will be most effective, to really do that assessment and make those kind of logical choices about what's the best intervention to go with. So now before I go into the next section, we're going to go to another quick poll. And so next we're going to talk about effective interventions. And so we want to start with asking you what you think effective interventions include. So from this list, which do you think is the correct choice for what CDC officials consider to be an effective intervention? And I'll wait for a moment while you answer the poll, and then we'll review the results. Let's see here. So just take one more minute to go ahead and make a guess. And if you don't know much about all these interventions, that's okay. We're going to talk a little bit more about them today, but more importantly, we'll give you information about where you can go to get lots more information about these. All right, great. So most of you got it right. In reality, CDC considers all of these to be effective interventions. So very good. You're already familiar. That's good. Okay, so let's look more closely at this topic now. Let's see here. Okay, having some. Okay, you're seeing that now. Okay, so CDC has a website that they've specifically designed to support high-impact HIV prevention. This is really specific to this new effort. And that website is here up at the top. It's www.effectiveinterventions.org. And this picture you're seeing here is a picture of the homepage. So there are a lot of great resources on this website, and it's continuing to change and expand and develop almost daily. So keep going back and checking, because there's a lot there. It includes resources, news updates, trainings, but the biggest feature is really an in-depth description and a set of resources for each of what CDC considers to be proven effective interventions. So some of the things that were in that poll and a lot more, some of the ones that we're going to talk about today, they appear on that website, and there's lots of detailed information about it available to you. And let's see, it's not advancing. Oh, there we go. So specifically, you can see on the left of the page here in this red circle a list of the 5 categories of high-impact interventions according to CDC. So within each of these categories are the specific interventions that CDC encourages. And if you go live to this website and you go over each of those blue bars, then it pulls up a whole new menu, a submenu of all the different interventions under that. So we're going to take some time now in this webinar to go through each of these categories. So the first one is biomedical interventions. And biomedical interventions are interventions that address biological and or medical issues. It's pretty clear. So 2 examples of biomedical interventions are the use of microbicides and vaccines to try to prevent transmission of HIV. And both of these are still in development. As you're all quite clear, we don't have an effective HIV vaccine at this time, and microbicides are on their way, but not really available yet. Although in 2008, there was a promising study of tenofovir microbicide gel that was shown to provide a 38% lower risk of HIV infection among women in South Africa. So it was the first time there was really promising results from a big microbicide trial, and hopefully that's a good sign that we're really coming along in that area. But an example of a biomedical intervention that's currently in use that you all certainly know about is treating HIV with antiretroviral medications in order to suppress viral load. And that reduces possibility of transmission to others, improves the health of the person with HIV. So that's easily a biomedical intervention. So these types of interventions have been proven effective in a number of studies. There's one from 2011 published in the New England Journal of Medicine that shows that among serodiscordant couples, so one is HIV negative and one is HIV positive, the ones where the HIV positive partner was treated early in their infection were only 1/28 as likely to transmit HIV to their partner than those who were not treated early on. So we know that antiretroviral medications are really important as a biomedical intervention. And there's currently 8 proven effective medication adherence interventions, or what's also known, as it shows in the slide here, as treatment adherence interventions. And the second webinar in the High Impact HIV Prevention series, which is 2 weeks from today, will go more in depth about linkage to care and specifically about treatment as prevention and treatment adherence interventions. So if you're interested in those, you can learn about that a lot more in 2 weeks. But for now, I'll just say that their interventions, treatment adherence interventions, are interventions that are designed to help people with HIV adhere to their treatment regimens in order to improve their health and prevent the likelihood that they transmit HIV to others. So the next big category is public health strategies. And this includes strategies to quickly and effectively link those who test HIV positive to high-quality medical care, as well as screening and treatment of sexually transmitted infections, or STIs, since research indicates that STI treatment may significantly reduce rates of HIV transmission in people who are HIV positive and also have an STI. If they get that STI treated, then they're less likely to transmit HIV to others. And the public health strategies category also includes making free HIV testing widely accessible to those at risk. So proven interventions within this category of HIV testing include personalized cognitive counseling, or PCC, and RESPECT. You may have heard about those before. The third webinar in this High Impact HIV Prevention series, which is on July 11th, will provide a lot more detail about HIV testing strategies specifically, including those 2 I just mentioned. But for now, I'll just say that they're both designed to be used with HIV testing strategies to reduce people's risk behavior. So that's the idea there. The third big category is behavioral interventions. Those are the ones you're probably most familiar with above everything. Some behavioral interventions are designed to reduce HIV transmission by working with people living with HIV, such as CLEAR, WILLOW, Partnership for Health. And some of them are intended for people at high risk of HIV infection, such as Empowerment, Healthy Relationships, Popular Opinion Leader, or POL, Many Men, Many Voices, D-UP. So there's a whole group of them listed here. And behavioral interventions can be focused on the individual, group, or community level. There's a whole bunch of different varieties. And obviously we don't have time to go into details about all these interventions today, but the effectiveinterventions.org site has a wealth of resources, toolkits, etc. for each of these interventions. So if you're interested in specifics about any of them, you're certainly able to go to that website and learn a lot more. Behavioral intervention specifically is an area of emphasis that's really changing a lot with the new emphasis on high-impact HIV prevention. So a lot of these interventions have been around for a long time. You're probably familiar with them, and there's a whole host that have been around for a while. And but there's 14 specific ones that the CDC will really be emphasizing as they move forward with this high-impact HIV prevention approach. So we wanted to take a little time today to just show you which ones those are. So the high-impact interventions for people living with HIV that are emphasized by CDC moving forward are CLEAR, Healthy Relationships, Partnership for Health, and WILLOW. And the ones that are high-impact interventions for MSM that will be emphasized are D-UP, Defend Yourself, Popular Opinion Leader, Many Men, Many Voices, which is also 3MV, sometimes referred to that way, and Empowerment. And then the scalable community-level interventions include RAP and Community Promise. Those are really focused on the community. And the single-session clinical interventions include 2 I mentioned already. So they include RESPECT, Voices, Sister to Sister, and then Personalized Cognitive Counseling, or PCC, which is usually used with HIV testing. So those are the 14 you should really keep your eye on moving forward, because those are the ones CDC will really be emphasizing. And then the fourth category of high-impact HIV prevention interventions are structural interventions. So these are interventions that work upstream, if you've heard that river analogy. They're really changing the structure of a system or community so that it's more difficult to transmit HIV right from the beginning. It's just changing the structure of everything. So one example of a proven structural intervention is condom distribution, because a robust condom distribution program means that free, unexpired condoms are easily available to pretty much anyone at risk for HIV. It's just out there. That's how the structure is set up. And condom distribution can be extremely effective at preventing the spread of HIV in a community, especially when it's combined with the fifth category we'll talk about in a minute, social marketing. So if you have a social marketing intervention to increase the acceptability of condom use, and then you have a structural intervention to make sure that condoms are widely available for everybody who wants to use them, then they can, in combination, they can be really effective, very high impact. So other examples of structural interventions are syringe exchange programs, substance abuse treatment, things that are really just changing the whole structure of the environment where people are living and trying to prevent HIV. And that leads us to the fifth category of interventions on the CDC's website there, which is social marketing. So social marketing is the use of marketing techniques to achieve social change and to improve the public's health by raising awareness and changing behavior. And it includes using social media, which is now part of any social marketing campaign, but it's not just social media. Sometimes the two get a little bit confused. So while there isn't specifically a quote-unquote proven intervention for me to talk about specific to social marketing, there are a number of good resources, including the toolkit that CDC has on their effectiveinterventions.org website, which is here on the left of the slide, the Health Communicator Social Media Toolkit, which is really useful. So one example I'll give you of a very successful social marketing campaign, which you may have heard about, is called HIV Stops With Me. And the website here is pictured on the right, the homepage of the website. So HIV Stops With Me was started in San Francisco in 2000, and now it's used in many different cities around the country, maybe even in some of the cities you all are calling in from. So the idea with a social marketing campaign is to change social norms and perceptions. And the idea behind this particular campaign is to focus on the personal strengths of people living with HIV, to affirm their ability to fight HIV stigma by being vocal about their HIV status, and then being a role model for taking individual responsibility to prevent any further HIV infections. All right, so those are the 5 categories. So now we're going to take a minute to hear from you before we continue. So if you could use the question feature to chat in your thoughts on this. We're interested in, given this new shift to high-impact HIV prevention, what are you most concerned about in terms of the changes that your organization may need to make? We're really interested in what you think, because there certainly are a lot of people who have a lot of different concerns. So please use your question feature, answer, give us your thoughts, and also feel free to chat in any questions you have at this time. Or if you would prefer, you can click on the raise your hand icon to ask the question live. We'd really like to hear from you. The next piece here that I'll talk about is going into a lot more detail about prevention with positives. So we're really moving into a whole different area of the webinar. So this is really a good time to ask questions if anybody has any.
So while everyone's taking a minute to chat in using their questions feature, I want to just acknowledge that really where this whole webinar series came from is what we have heard from community-based organizations around their concerns about the ways in which they are going to need to realign some of their prevention activities given this new emphasis on high-impact HIV prevention. So I just really want to encourage any of you out there who do have questions or concerns to go ahead and use your questions feature and share those with us so that we can really tailor the content of what we talk about to make sure that we're addressing your concerns.
Sonia, before I go on to the prevention with positive section, are there any things that people are chatting in that you wanted to share with the group?
Yeah, so we're getting some great comments here from you about what some of your concerns are. We're seeing a lot of folks saying funding, that needing more funding to implement things. Concerns about other populations that don't already have documented evidence-based effective interventions and whether those populations are going to get the attention that they need, such as transgender, youth, women. We have a lot of comments about funding, people's concerns about funding. We have a couple of comments here that the first 2 categories are being emphasized more than some of the other high-impact HIV prevention categories. So the first couple categories that we had were around the biomedical interventions. And the concern, I think we're hearing this a lot in your comments here as well as in what we have heard from organizations we've worked with, just that this is the emphasis on biomedical interventions in particular is going to be more challenging for some of the smaller organizations, particularly those who aren't already working with or partnering with kind of medical care providers. So we have a question here also about whether we foresee CDC pairing interventions in the future, such as HIV testing and PCC. That's a really great question. Thank you for asking that. And the answer is absolutely yes. We're going to talk more in the third webinar of the series around high-impact testing in particular. A lot of this high-impact HIV prevention approach is really, it is evolving. It is evolving daily. As Shelley said, there's more and more materials being posted on the effectiveinterventions.org website literally every day. But, you know, part of what we have based the development of this presentation on is the materials that the CDC has released so far, as well as what we've seen in some recent funding opportunities from the CDC. So we had the recent Health Department funding opportunity announcement. We also had the fairly recent, a year and a half ago now, the YMSM, Young Men Who Have Sex with Men and Transgender Communities funding opportunity announcement. And in the YMSM one in particular, the requirement from CDC around HIV testing was that people use this intervention called PCC. So we are definitely seeing there are pairings that the CDC is emphasizing. So we have a couple more questions about the CLEAR intervention in specific. We're going to talk more about CLEAR actually in the next webinar when we talk about linkage to care and case management interventions. So for right now, I will say that CLEAR is another one of the interventions, as Shelley mentioned, that is going to be emphasized moving forward. And there's more information about it on effectiveinterventions.org, and we will cover it more in depth in the next webinar as well. So right now, in the interest of time, I'm not going to share any more of those comments, but we will try to be posting those back out in your chat feature so you can see what other folks are saying in terms of their concerns moving forward with high-impact HIV prevention. And I will go ahead and keep reading through those and try to type in some answers to your questions, and we'll try to come back to answer some more of those questions when we get a little bit further along in the webinar. But for right now, we're going to move ahead with our next section around prevention with positives.
Great. Thanks, Sonia, and thank you all for chatting in such good questions and comments. It's really helpful to hear what people are thinking out there, and those are really good thoughts that you're bringing up for sure. So now we'll go to prevention with positives, which hopefully I can get to my slides to advance. There we go. Okay. So a major emphasis of the new high-impact HIV prevention approach is a strong focus on prevention with positives, which is, as Sonia said, why we wanted to make sure we took some time today to really talk about that in more detail. Prevention with positives, if you don't already know, is just what it sounds like. It's working with people living with HIV to reduce the possibility of HIV transmission to others. So now we'll delve into this in a lot more detail. Traditionally, HIV prevention programs have really focused on primary prevention, which means helping people who are HIV negative avoid infection. But prevention with positives is really what's considered secondary prevention, because these interventions help prevent further transmission to others. So you work with someone who already has HIV and prevent any secondary infections. In the new high-impact HIV prevention approach, there's a strong emphasis on prevention with positives. And there's 5 main rationales behind this emphasis. So we're going to go through what these 5 reasons are to help everyone better understand why it is that there's such a strong emphasis. So the first one is that there's many things that HIV positive individuals can do to support their overall health and well-being. And knowledge of their HIV status, being linked to various care services, including medical care, having all the information necessary to make healthy decisions can dramatically impact the overall health and well-being of HIV-positive people. So linkage to care includes linkage to high-quality medical care, which for some may include HIV treatment. And as we talked about a little bit earlier, antiretroviral medications have been around for over 15 years, and we've seen really amazing changes in the overall health and lifespan for HIV-positive people during that time period. It's really important. So while not everyone will choose to take HIV medications, having access to treatment, which includes knowing your status, being linked to care, having the information and support that you need to make healthy choices, is an essential tool for supporting the health and wellness of HIV-positive people. And prevention with positives interventions are an important way to help HIV-positive individuals learn about and explore their options to best support their health and well-being. One of the reasons they're really emphasized. The second one is that we know that drug resistance is becoming an increasing problem for people with HIV. Drug resistance reduces someone's treatment options and can ultimately impact their health. It's not a good thing. So when a person with HIV is on treatment, it can be hard to take the medication exactly as prescribed. And when this happens, it's possible for the virus inside their body to become resistant to one or more of their medications. And then those medications cease to work for them. So drug resistance decreases the effectiveness of the treatment, and it can impact their overall health and well-being. And then later, if that virus is transmitted to someone else, they can get a virus that is resistant to those same medications even though they've never taken them, which limits the types of medications that the new person can take to stay healthy and prolong their life. So it's kind of a spreading problem. And the prevention with positives interventions can help HIV-positive people who are taking medications to take those medications more consistently, and that's, as we talked about, the treatment adherence medications, treatment adherence intervention, before. And when they take those medications more consistently, it reduces their chances of their virus becoming drug resistant and increases their options for staying healthy. So it's really important for that reason. The third reason to focus on prevention with positives is that research has shown that once people know they have HIV, most people really don't want to give that to anyone else. Probably not a surprise to any of you. So they want to take steps to prevent any further transmission. And so knowing your HIV status, being able to communicate about it, making safer sexual and needle-sharing choices are really essential to prevent transmission. And prevention with positives interventions are designed to support HIV-positive people in making these safer choices and in preventing transmission to others. It's really helping them do what they already want to do. Along the same lines, the fourth reason is that we know that people living with HIV continue to have sex. Once upon a time, there was this idea that if someone found out they had HIV, they essentially became celibate. That's what people thought. But we know now that that's not true. Surprise! In fact, data have shown us that about 70% of people living with HIV have sex after the diagnosis. And the longer that someone knows they have HIV, the more likely they are to be sexually active. So prevention with positives interventions are important because they're intended to help people living with HIV learn how to have enjoyable sex lives without risking transmission of HIV to others, which is really important. And finally, we know that people living with HIV have unique social and medical needs, and it's important that we have tailored interventions that meet those needs while addressing more typical HIV prevention topics that you might find in any other intervention geared more towards high-risk negatives. It's really specializing what we're doing and making sure that it's appropriate for the target population. So if you'd like more details about the data and the studies and everything that goes behind these 5 rationales for focusing on prevention with positives, you can see that information with all the complete references in the Prevention with Positives information sheet that accompanies this webinar. So hopefully you're able to access that and see lots more detail if you're interested. So before I go into more information, we're going to do one more chat feature where you can use the question feature to answer, because I know you have great things going on that you're thinking of. And so we want to take a minute to hear from you about what you're currently doing, what types of prevention with positives interventions you currently use in your community. And again, feel free to chat in any questions you may have at this time, or click on the raise your hand icon to ask your question live if you'd prefer to do that. I'm again going to let Sonia, I know she's gathering a couple things here, some of the things that you're saying, and it would be, she'll speak up in a moment and share a couple of those before I go on to the next piece.
So I really want to share with you just so many things that people are saying, which are really interesting, and actually from the last chat too. But just for this particular question that folks are chatting in about right now, we're seeing some responses that folks are using CLEAR, which somebody had asked a question about before, that folks are using CRCS, Healthy Relationships, CLEAR, Empowerment, Safe in the City, condom distribution, partner testing, healthy relationships, MIP, CTR, so tons and tons of different interventions that folks are using. Also, someone just made a comment about availability of assistance with medical care, the Ryan White program, medical care for uninsured. And a lot of folks are commenting about using specific testing interventions, so using rapid testing, using condom distribution. So yeah, we're seeing actually a wide variety. We'll go ahead and post some of these so you can read them as well, but a wide variety of comments about what's already happening in communities in terms of prevention with positives. So let's actually talk a little bit more about what some of the interventions for prevention with positives are.
Great. So now we'll discuss how to set up a comprehensive and effective prevention with positive strategy. So a lot of you are already doing these prevention with positives interventions, which is really great. And especially in this new era of high-impact HIV prevention, we really want to all work to have a really comprehensive strategy where we're thinking very thoughtfully about how we're handling prevention with positives overall. And so this comprehensive strategy like this can really include effective interventions at individual, group, community, and structural levels. And so we'll go through what some of those interventions are specifically. At the individual level, interventions are focused on promoting, reinforcing, and maintaining healthy behavior for a specific person or many specific people. So the advantage of individual level interventions is that they're private, they can be tailored to the needs of a specific individual. And you all, I'm sure, have some good experience with those types of interventions. The main disadvantage is that they're time intensive, which can also mean they're less cost effective. And so they really need to be targeted at the most, the people who really would benefit absolutely the most from this kind of intervention. So one example of an individual level prevention with positives intervention is CRCS, which is listed up there in the red lettering on the left, which stands for Comprehensive Risk Counseling and Services. So many of you have probably heard about that, but if not, you may have heard the term prevention case management, which is what CRCS was referred to at one time. So they're really very similar. It's ongoing case management that's focused on reducing risk for HIV-negative people, but also in supporting HIV-positive people in reducing or preventing HIV transmission to others. So unlike old traditional prevention case management, CRCS really has a focus on prevention with positives as well. Another example of an individual level prevention with positives intervention is partner services, which is an intervention to support people with HIV in being sure that their past sexual and needle-sharing partners are tested for HIV if they may have been exposed. It supports them in making sure that the information gets out and that those people can access testing. Another individual level intervention is CLEAR, which came up in the chatting questions before. And CLEAR is a multi-session counseling program that helps people with HIV improve their health and reduce transmission to others with really a holistic model. And many organizations now are using CLEAR as the structured curriculum for their CRCS interventions. So those two can really go together. And then one more example that CDC is really emphasizing is Partnership for Health, which is a behavioral intervention that uses message repetition and reinforcement for HIV-positive patients during their medical visits. So it improves patient-provider communication in order to improve medication adherence and overall health for HIV-positive people, which also leads to reduced transmission. And so therefore, it's a really important prevention with positive strategy that's focused on individual patients. At the group level, interventions are focused on providing education, risk reduction counseling, skills building, and support in a group setting. So again, this is probably really familiar to a lot of you. The advantage of group-level interventions is that they're really excellent for providing peer support, for decreasing stigma and isolation, and for allowing the exchange of ideas among people with HIV, which especially in certain areas may be really important to bring people with HIV together and allow them an opportunity to really exchange ideas. The main disadvantage is that group-level interventions are really only good for people who are comfortable with being openly HIV positive. If they really aren't comfortable sharing it, then a group-level intervention really won't work for them. So some examples of group-level prevention with positives interventions that we'll mention now are Willow, which is a 4-session small group behavioral intervention for adult women living with HIV, and it emphasizes gender pride, teaches communication skills for negotiating safe sex, distinguishes between healthy and unhealthy relationships, and teaches coping strategies to reduce life stressors. It's really the focus of Willow, which certainly works to reduce HIV transmission. Another one is healthy relationships, which I talked about a little bit earlier. It's a 5-session intervention, and it's based on social cognitive theory, which may be familiar to a lot of you. And it's really intended to build skills and self-efficacy for new behavior. That's the idea there. And then the third one is TLC, which stands for Together Learning Choices. And that's also a behavioral intervention. That's for people ages 13 through 29, so essentially youth who are living with HIV. And TLC helps young people increase their use of health care, decrease their high-risk sexual behavior, and their drug and alcohol use. And it does that in a group setting. So those are all group-level interventions that CDC is emphasizing moving forward. And finally, at the community level, interventions are focused on changing attitudes and behaviors of entire communities. It's pretty obvious. So the advantage of community-level interventions is that they can really have extensive impact. If you can really affect a community, then you're affecting a lot of people all at once, and that's really important and high impact. The main disadvantage is that they can be really difficult to measure. So measuring effectiveness is really challenging. Often, even the best community-level campaigns produce very little measurable change in the community, or at least change that can be attributed specifically to that intervention. So there have been cases where it was clear that there was some kind of change going on, but it was nearly impossible to attribute it to a specific community-level intervention. There's always lots of things going on that impact a community, for better or for worse. So it's really hard to measure it and prove that it's specifically being effective. So an example of a community-level prevention with positives intervention is HIV Stops With Me, the social marketing campaign that we discussed earlier as an example. But there's certainly plenty of examples out there. So speaking of examples, we'd really like to hear from you what other community-level prevention with positives campaigns you've seen in your community. So if you could use your question feature to answer and let us know what some of those are, that would be really excellent. This is the great thing about having so many people to participate in a live webinar, because we all have the chance to learn from each other. It always amazes me the wealth and variety of experience that people have with HIV interventions. And we don't often get the opportunity to hear about them outside of our own little community, so it's really great that we can gather that information from you in a thing like this webinar. Sonia, is there anything you want to jump in and share before I go on to the structural level interventions?
We're seeing lots of great comments, as always. It is really exciting that there's a lot of folks on here to share their experience today. So there have been some links shared about resources in people's communities. We'll make sure those links get posted so everybody can see them. There's been a question about specific training for agencies around case management. And I'll actually encourage folks to share resources that they know of in their communities around training for case management. But again, in the next webinar, we'll talk a little bit more about some of the specific case management interventions that are geared towards linkage to care. So we'll talk a bit about CLEAR and CRCS, as well as ARTIS, which is not quite typically a case management intervention, but is done in a case management-like approach. And there's training available with all of those interventions through the CDC in particular. See if we've got another question we should focus on now. I think we'll go ahead and just post back the comments that folks are sharing and the resources people are sharing in their communities. And again, we'll try to open up for some more questions again at the end of the presentation.
Okay, great. Thanks, Sonia. So the last one is structural level interventions. And so these are just what they sound like. They're designed to remove structural barriers and improve a person's ability to make healthy choices and prevent the spread of HIV. And we talked about that before. So structural interventions can address physical, social, cultural, organizational, community, economic, legal, policy circumstances, really anything that affects an individual's ability to prevent the spread of HIV. It's not really focused on them and their own behavior, but just on the structure around them. So some examples of effective structural level prevention with positives interventions are improving access to condoms and sterile syringes, like we talked about before, and making substance use treatment available to people with HIV. So these things are really structural level interventions to prevent HIV for everyone, whether in primary prevention where someone may be at risk for HIV but doesn't have it, or people who have HIV in preventing them from spreading to anyone else. So either way, these are important structural level interventions, but certainly when they're focused on people who have HIV, then they're important prevention with positives interventions for us to focus on. So we're drawing to the end of the webinar, but I wanted to take a little bit of time to talk about issues to consider when implementing prevention with positives programs. So HIV prevention with positives programs must really recognize that the most important commitment is protecting the health and well-being of people participating in your prevention with positives interventions. So this really means providing access to high-quality care and treatment to help improve their health and suppress viral load, and protecting privacy and confidentiality at all times, which is really important to prevent discrimination as a result of continuing stigma about HIV, which we know still exists, and promoting shared responsibility between both HIV negative and HIV positive people to prevent HIV. All of these things are really important. And it's important in all jurisdictions, but it's particularly important in those with laws that criminalize the transmission of HIV. And we wanted to make sure we pointed that out today because this type of criminalization further adds to the stigma and discrimination against people with HIV, and it increases the possibility of incarceration due to HIV positive status. So it's a really important issue and especially important in those communities, although it's really important everywhere. By taking these issues into account, we can all feel more confident that our prevention with positives programs are helping and not harming people with HIV. So I just want to sum up here my part of this webinar with some final thoughts. Many people see the transition to high-impact HIV prevention as a challenge. We know there are challenging things, and you've chatted in some of those things today. Or they're resistant to some of the changes that it means for their organization and their clients, even if it seems like a good idea, it can be really challenging. So it's always good to critically evaluate new strategies, especially since, as we talked about earlier, we have 30 years of experience doing HIV prevention work, and we've really made a difference. So it's also important to recognize that sometimes change is difficult, but it's ultimately good. And this is really a great opportunity for us all to use our expertise to evaluate our choices, to be sure that the HIV prevention interventions that we are using are really high impact. And this is actually a really good opportunity, even though at times it's challenging. So hopefully this webinar helped you to feel more equipped to do that and to move forward into this new era of high-impact HIV prevention. So now I'm going to hand it over to Sonia for a couple closing thoughts from her.
Thank you so much, Shelley. So, you know, as I said earlier in today's webinar, this whole series was really a response to the kinds of concerns we were hearing from community-based organizations. And I think one of the things that I want to really frame around how we talk about high-impact HIV prevention, and also just reminding you that there are 2 more webinars in this series, but to really recognize that high-impact HIV prevention is an approach. So it's not a prescriptive thing, specific thing that organizations are doing or should do or need to do, but it's sort of a whole approach about how we take everything that we've learned in this last, 25, 30 years of HIV prevention as a field, which is, a big national field, and how we really take that and get the most effectiveness possible out of it. So I think it's been a really important time in the history of HIV prevention to kind of step back and look at the big picture of what not just each individual intervention that we know has effectiveness or has evidence behind it, but that really big picture of how we get those 5 considerations, that cost effectiveness, full-scale implementation, specific targeting, all the things that we talked about that are really the highest priorities now for HIV prevention. So really what we're hearing people talk about and think about is how they may need to realign their specific programs to bring them more into alignment with what we now understand as the kind of high-impact approach. And so like I mentioned earlier also, we're drawing some of the content of this webinar, we're drawing not just from the CDC's website and what they've published about high-impact HIV prevention, but also what we've seen in the last several funding opportunity announcements that have come out since the beginning of the CDC's using this language around high-impact prevention. And so we definitely have seen that there has been a shift in the way the CDC is asking programs to do HIV prevention, the programs that it's funding. And specifically, some of that has been around bringing in interventions from all 5 of those types of areas, so the biomedical interventions, the behavioral interventions, the structural interventions, the social marketing interventions, and really making sure that there's a combination of those interventions that's being used in communities. And a lot of this really has involved making sure that there is a strong emphasis on prevention with positives, as Shelley has mentioned, as we mentioned earlier in the webinar. The idea that prevention with positives really meets a number of those considerations around cost effectiveness and targeting and scalability and implementation. And so that's been a piece that has been around for a long time but is being emphasized really much more strongly right now in high-impact HIV prevention than it ever has been before. So Shelley, if I can get you just to keep advancing the slides, since I think you still have control over them, that would be great. We've been getting tons and tons of chats in from you and a lot of questions, and we recognize we haven't had an opportunity to answer all of them yet. So we will definitely stay on the line and keep both typing in answers and answering things verbally. But if you want to just share with us anything that you feel like has been really significant that you're going to take away from this webinar in terms of how you might realign your work to bring it more into alignment with this idea of the high-impact HIV prevention approach. And while you're doing that, again, you can just use your questions feature to chat in your bright ideas. While you're doing that, I want to talk a little bit about further resources and next steps. So the next slide actually talks about some additional resources. So we have an information sheet, actually several information sheets that will be online in our online resource library. We have a summary of the high-impact HIV prevention approach. We have a summary of prevention with positives. We also have a couple of information sheets that are part of the next webinar that will be coming in 2 weeks around treatment as prevention, around prevention with positives. Also, we've mentioned the effectiveinterventions.org website. We've mentioned that quite a few times. There's great resources on there in terms of the many, many, many different interventions that are being emphasized within this high-impact HIV prevention approach, as well as within prevention with positives. And then our online resource library, which you'll see the website listed on the next slide if you actually want to just advance to that, Shelley. Actually, it's on the slide after that, sorry. Can you go one slide more forward for a second? Thank you. So the online resource library is the website you see listed there, library.capacityforhealth.org. We have tons and tons of webinars and information sheets and resources on that website. The audio recording of today's webinar will be there. The slide set of today's webinar will be there. As I mentioned at the beginning, we also have an online training version of all of today's content. It's actually in 2 separate modules, one on high-impact HIV prevention, like an overview, and the other on prevention with positives. So those things are all in our online resource library. And then, as I mentioned, we're available for individual capacity building. It's totally free support services, and we are more than happy to talk more with you and work more with you to help you think about how to implement more high-impact HIV prevention. So our direct contact number, email address, and telephone number are on your screen right now. And finally, if you want to just go back one slide, Shelley. Finally, as we've mentioned numerous times, this is the first in a series of 3 webinars. So today's webinar was really meant to be more the overview level, kind of that macro picture of what this high-impact approach is and what it means, and some of the specific interventions that are being emphasized. But the next 2 webinars really drill down more to the level of the interventions. So the next webinar on June 20th is focusing on linkage to care, and specifically some of the treatment adherence or medication adherence interventions that have been shown to be effective and that are being emphasized now. And then the 3rd webinar on high-impact HIV testing, which will be on Wednesday, July 11th, will focus on different kinds of testing, rapid testing, and opt-out testing, opt-out routine testing in medical settings. But also we'll look at the HIV testing interventions like PCC, personal cognitive counseling, or like respect that are being emphasized, and also talk a little bit about some of the new HIV testing algorithms. And some of that is actually really hot off the presses, hasn't even officially, completely, totally been published yet. But there's been starting to be a lot of talk about it within CDC and other organizations, and so we're going to share a little bit of those hot algorithm topics with you as well. So that basically concludes the content of today's overview of high-impact HIV prevention webinar. Like I said, we're going to go ahead and stay on the line and try to answer some more questions, both typing in answers to questions that you typed, but also at this point, if folks want to ask questions live, I would encourage you to click on your raise the hand icon. It's the little green hand icon on your webinar control panel, and we actually can unmute you, and you can ask your question live. I know there's still a lot of people on the line, so we may not be able to get to everyone's question, but we will do our best. And please, if we did not answer your question today and you would like to be in touch with us further, please use the email address or the phone number listed on your screen. We are more than happy to talk with you and try to answer some more questions about high-impact HIV prevention. So for any of you who are about to sign off, thank you so much for having joined us today. Thank you, Shelley, for joining us today and presenting. I'm going to go ahead and read some of the questions that folks have chatted in, and we will do our best to try to answer some of them. So we have some recent questions here. I'm going to go ahead and start with this one. Sorry, we've got so many wonderful comments there. So there's a question here about PrEP and post-exposure prophylaxis and the affordability of them. So I think in the biomedical intervention section, we've mentioned a little bit about PrEP and NPrEP, I think, non-occupational post-exposure prophylaxis. And there has been some really, really good research, and there is much more research needed and much more research happening. And the work that I've seen primarily here in San Francisco has been very, very committed to making both PEP and PrEP available to folks. And even though there is, not much insurance coverage for PEP and PrEP yet, and so we've seen PEP and PrEP offered here locally through most of the public hospitals and public emergency rooms at no cost or at sliding scale. So I think folks are working hard to try to make PEP and PrEP affordable to folks, and there's always lots of research continuing to happen about that. We had another question about the high-impact HIV prevention approach really having a lot of similar components to the work that has been happening for a long time in our communities, but different language about the way we talk about it. I think that's absolutely true. There are very, very few brand new kinds of elements. We are seeing some new interventions like personal cognitive counseling, or PCC, which is sort of just coming out, or ARTIS, which is a linkage to care intervention that's sort of just coming out. But most of the interventions that are being emphasized in high-impact HIV prevention are interventions that have been around for a while, and it's really about that issue of prioritization and thinking about the considerations of cost-effectiveness and of full-scale implementation and of specific targeting, and thinking about how we balance all of those elements in choosing which interventions to implement. So one of the biggest things I think we've seen is that there's a real shift away from a primary focus on almost exclusive emphasis on behavioral interventions, and there's more of an integration now with things like biomedical interventions, structural interventions, and social marketing. So it's really about perspective, I think, and prioritization. And there are a handful of new interventions coming out as well. So we have a few more questions. And these are more comments that folks have sent in. So we have a question here about whether the CDC would share an assessment of the EBIs that have been funded to date. I think that's a great question. All of the EBIs that the CDC was disseminating through the Debbie Project or is disseminating through the Debbie Project are interventions where there was a lot of research evidence behind them, and that evidence has largely all been published. and is available in peer-reviewed journals, as well as links to those original studies and publications are available on the effectiveinterventions.org website. There has also been a wave of research around how those EBIs have been implemented in communities and how effective that implementation has been. In fact, there's been a project just in the last 5 years to do some more rigorous evaluation of community implementation of some of the evidence-based interventions. And as far as I know, the most recent funding cycle of that, they haven't published or released the results. In fact, I think they're still doing those evaluations. But some evaluations have been done of implementation of specific interventions. And again, that material has been largely published in peer-reviewed journals. And links to it are available. Quite a few links to those articles are available on effectiveinterventions.org. If whoever wrote that question had a specific intervention that they were interested in, I'd be more than happy to help you find the research evidence around the implementation of that intervention. And so, let's take a couple of more questions. I have a question here about structural level interventions and mental health services. I think that's a great thing to try to include or think about including in structural level interventions. So structural level interventions, again, are just interventions that really focus on changing the structural circumstances, so whether it's legislation or availability of service or access to services, so rather than focusing on individual behaviors or kind of that group level approach, which is still often about individual behaviors, it's focusing on the structural kind of factors that influence people's decision-making and people's risks and people's behaviors. So I think that mental health service, I know we talked a little bit about substance use services as an example of structural interventions. I think mental health services and access to mental health services is another great example. Whether it's legislation or the existence of services or funding of services or access to services in a way that then changes the risks of HIV transmission in communities is it's a really important thing to think about mental health services as well. So thank you for sharing that. I've had a couple of questions about wanting specific resources, specific trainings, resources around universal precautions, resources for HIV/AIDS prevention among American Indian communities. So I'd say I'm not sure that we can answer every question about specific resources, but in terms of resources for HIV prevention among Native American communities, there are also some great resources around that. CDC has been funding HIV prevention in Native American communities and had some really wonderful, very specific projects actually recently. And there should be links to all of that stuff again on effectiveinterventions.org. But if you're not finding what you're looking for there, please feel free to get in touch with us individually, and we are more than happy to help you try to find those resources or connect you to those resources. So I'm not seeing any more specific questions coming in. If there's anybody, it looks like there's still quite a lot of people on the call. So if there's anybody who would still like to ask a question, I encourage you again to click on your raise the hand icon, a little green hand icon. We can unmute you. You can ask your question live. Or if there's anybody who has a question that we have not answered. So we've got some great comments that folks are sharing. I'm not sure that most of these aren't necessarily questions, they're just comments people are sharing. We can post them back so other people can see them. But there's a question about the expensiveness of HIV medications. I think I'm not sure anybody can answer that question about why they're so expensive. I'm sure there's lots of theories about, the pharmaceutical industry and the insurance industry. But, we have been lucky for a long time in the United States that there has been ADAP, so we have had, funding, federal funding to help support people in being able to afford and access HIV medications. Internationally, that's been less common, although pharmaceutical companies are, many people have been working very hard to try to work with pharmaceutical companies and make the access to medications more affordable. We have a question coming from Sandy. We're going to go ahead and unmute you. You should be unmuted now, Sandy, if you'd like to ask your question live. We're not actually hearing you, Sandy. You're unmuted on our end. No? Okay. It looks like we have a question from Butch. We're going to go ahead and unmute you, Butch, if you'd like to ask your question live. Oh, dear. Well, we're not actually hearing you either. I'm sorry. I'm not sure if we're having some issues with our audio or with unmuting people. If you didn't enter an audio pin, we may not actually be able to unmute you. For those of you who called in on the telephone, if you didn't enter your audio pin, we probably can't actually unmute you. So please go ahead, Butch or Sandy, since we weren't able to hear you, go ahead and type in your question if you'd like. There was also a question a few minutes ago about how to support people newly diagnosed. And I think that that's one of the biggest issues that comes up in terms of, we've talked a lot today about prevention with positives and how to provide people with social and emotional and physical support around their diagnosis. So there have been many amazing programs and interventions specifically around working with new diagnoses. There's some great materials in some of the case management curricula, like in CRCS or in CLEAR. The ARTIST intervention, which is one of the new linkage to care interventions. We're actually going to be talking more about that in 2 weeks in the linkage to care webinar. Has also some good kind of structured curricula around how to support newly diagnosed HIV-positive individuals. Also partner services programs that are available in many communities often have some good material around providing the emotional, psychological, and social support. I'd say that's one of the places really in preventions with positives work where peer programs have been so important and so effective, and that new diagnosis is often a time when peer support can be really helpful. So again, if somebody, if the person wrote a question wants information about more specific resources in their community, we are more than happy to help you tap into or find those resources. Again, just go ahead and contact us individually about that. I'm glad we're getting so many questions. We can continue to stay on the line as long as we are getting questions in. So we've got a question here about how to get capacity building from us. So as you can see on our screen right now is still our phone number and our email address. And feel free to just go ahead and give us a call or shoot us an email and let us know what it is that you would like support around. Because we're funded by CDC, our capacity building services are totally free. However, we do have some priority areas based on the CDC's prioritization. So obviously we prioritize organizations that are doing HIV prevention. That's kind of a given. But also within that, we have to prioritize folks who are funded by CDC or who are funded by their local health departments who are funded by the CDC. But depending on availability, that's not a strict limitation. So just go ahead and get in touch with us, and we will do our best to either provide you with support services or connect you to other folks who can if we're not able to. So somebody typed in, speaking of peer support, our agency has started talking about a peer mentor program. Can you recommend any? It's a great question. There is not a structured curricula around peer-provided support just in general, but there are many different kinds of peer support programs. So actually next week when we talk about medication adherence interventions, there are a number of there are 8 interventions specifically that we're going to be talking about that have a lot of evidence behind them, and a number of those are peer-implemented interventions. And there are certainly really good models of peer HIV prevention with many different populations, as well as peer support groups. In terms of peer support, I think you might be referring to support for HIV-positive individuals, and there's some great models. There are some sort of navigator models that are often peer implemented for, again, this is more linkage to care, which we'll talk about in the webinar coming up in 2 weeks. But again, I'm happy to, if you want to just get in touch with us individually and let us know what your community is, where you are, we can actually try to connect you to some models of programs that have been operating already in your community or your area. So I think that looks like most of the questions that we've gotten in typed in so far. I'm not sure if there's anyone who's still raising their hand trying to ask a question live. No? Okay. All right, well, I guess we will go ahead and close out today's webinar. Thank you all so much for joining us. Again, just as a reminder, the recording of today's presentation, as well as the online training version of this content, as well as some summary information sheets, will all be available in our online resource library. Give us a couple hours to get this uploaded, but it should be all available online within by the end of the day today. And then please feel free to stay in touch, get in touch with us, the email address or the phone number you see on your screen, or please join us for the next 2 webinars in this series. So Shelley, if you don't mind going back one slide, I'll just show again the webinar series times. So the next one, Wednesday the 20th, same time, on linkage to care, medication adherence, and then part 3 on high-impact HIV testing will be Wednesday, July 11th. So please join us for those 2 webinars, and we look forward to seeing you on future webinars, as well as working with you individually if you have capacity building assistance needs. So thank you all again for joining us. We're going to go ahead and officially